Welcome to the American Association of Critical Care Nurses Voices in Nursing podcast, exploring critical care nursing through meaningful and inspiring conversations. This episode is sponsored by AACN's award-winning online leadership course, Fundamental Skills for Nurse Managers, with information available at www.aacn.org/manager skills. Now, here are your hosts, AACN's Chief Clinical Officer, Dr. Vicki Good, and Clinical Practice Specialist, Andrea Schmidt.
Welcome to the Voices in Nursing podcast. I'm Andrea Schmidt, a clinical practice specialist at AACN, and I'm joined by Brandy Peck, AACN's content strategist.
I'm so excited to be here, Andrea. Thank you.
I am glad that we are working together on this episode. We are going to focus today on burnout, and I think we all realize how much healthcare landscape has changed, especially since the pandemic. And there's been a lot of conversations around burnout, and they're becoming more urgent than ever. Nurses and leaders alike, I really think, are carrying very heavy emotional, physical, and operational loads. And I think it's really creating an impact.
I think that's why today's discussion matters just so much. Like Andrea said, we're exploring how organizations can better support those leaders who really then in turn support everybody else. So our guest today is Dr. Robbin Young. She is the CNO at the University of Alabama College of Community Health Sciences. She has invested deeply in leadership, well-being, reflective practice, and innovative approaches to restoring balance in healthcare environments. Dr. Young, we are just definitely excited to learn from you today. Can you please introduce yourself?
Thank you so much. I'm Dr. Robbin Young. I'm currently the chief nurse with the University of Alabama. I've been in healthcare over 25 years. I was a critical care nurse for over 15 years, and I'm excited to be here.
Well, we are very happy to learn all about this endeavor that you've taken, and I would like to start by thanking you for taking on this initiative because I think it's so important. So my first question for you is really, what was the driving force that led you to begin your work on leader burnout specifically?
Leader burnout has been a topic of mine that has been of interest for some time now. I've been in leadership over 20 years. And so we've always tried to focus on our well-being, but of course, as nurses, we always focus on how can we better care for our patients and our families and not necessarily ourselves. When I transitioned to Alabama, coming up on 2 years, I did recognize as we made it through COVID that some of our leaders were struggling with how to better take care of themselves. How do they manage their time? How are they able to also focus on their staff and being able to meet their needs as well? And so my first year here, we came up with some initiatives that we wanted to really focus on to really not just take care of our staff, but to take care of our leaders and how we can better support them.
Before my life here at AACN, I was a nurse manager, and let me just tell you, it's not for the faint of heart. That is not for me, and I commend you for your amazingness. We do talk about how we definitely did not prioritize myself, and I think most nurse leaders are in the same bucket. You know, we see everybody else, and we're like, we're going to fix it, we're going to help them, but at the end of the day, nothing, right? Nothing for us. So why do you think that it really is so difficult for people to prioritize themselves and refill their own cups?
Well, from my own personal experience, I found that I gave so much to everybody else and I didn't give anything to myself. And so
there's nothing left.
There's nothing left. My cup was definitely depleted. And I also started seeing changes in my own health, my own personal health. And I felt that if I didn't make a change to how I look at my position and how I'm able to give to others, but also give back to myself and really prioritize that, I probably would have still continued to have a decline. And so when I kind of took a step back and really thought about what can I change? What can I do differently? How can I continue to still do the best job that I can, but also focus on myself? Because if my cup is always depleted, how do I continue to give to others? And so I really made a conscious effort to make sure that I put time aside to take my PTO. I was maxing out every year on PTO and I never used it. To schedule those vacations that I wanted to do, to be able to set time aside to really think through some strategic initiatives that I wanted to do, but place it on my calendar so that I always had that designated time. But also, how do I make sure that what I'm doing also trickles down to my other leaders that I manage? Because you do have a sense of guilt. You
That's
take
exactly
off.
what I was going to say. Guilt. Like you just feel so guilty.
You
Like
feel bad because you're
I can
like,
do
I
it.
know
Let
that
me just give
I
just
know
a
that
little bit
today is going to
more.
be a busy day.
Right.
You look at those
Right.
schedules ahead of time. You know that certain people might be already out. And so you do have a sense of guilt to, do I really need this day off or can I just manage and just try to rest up over the weekend and come back on Monday a different person? And so we really thought hard about, okay, if somebody takes off, how do we support them? How do we take away that guilt piece? And how do we make sure that whatever they do need to do on those days that they're generally here, how do we make sure we can take some of that load so that they don't come back to so much? Because there are times when you take off and then you come back to a stack load of things that now you have to get caught up and you're trying to dig your way out. It almost defeats the purpose of even taking a day off because you have to come back to so much. And so it's still a work in progress. I'm not going to say that it's perfect, but I feel that my leaders do now feel a little bit of that weight lifted off where they feel more comfortable to take a day off. They feel more comfortable to take more than one day off at a time. Because that was another discussion that we had. And last year we did a whole 6-month training. And that 6-month training really focused on well-being. It focused on being able to rest. It focused on how do you best support your team if you're not supporting yourself. And so we had workshops every month with our youth leadership team. I actually had to do a whole initiative fund to get this funding to pay for those services.
Yeah.
But it
Like
was
how
well
did
spent.
the people like did you like make them off work?
So what we did, we were a little creative because initially with that company, they came on site, they did these long workshops. We asked for a different way to do it. So we split it up where every month we designated 2 hours of time where everybody is out of staffing. We provided them lunch if we could. It was virtual. And then we also had, in addition to that training, we had like a book club. So out of the 25 leaders that I had, we broke them up into groups. And I strategically moved people around that hadn't always worked together with each other so that they could get to know each other as a team. And they had to meet monthly to kind of talk through some of the chapters prior to our next session, because we did reflect on what was in those chapters, what was some of the feedback, what are you going to take away from it? And it was a workbook. So they were able to take notes, they were able to put down their thoughts. And we got a lot of great feedback from that. And we didn't just focus on nursing, we also focused on other areas that support us. We focused on our front desk staff that usually manages those patients. We focused on lab. We focused on our librarian because she helps us with a lot of the projects that we're doing. And she gave a whole different perspective that we weren't even thinking about through that whole process. But through there, we came up with some initiatives that we wanted to really focus on and try to execute during that process towards the end.
I have so many questions. I think this is such a great, concept. And my previous life, when I worked in a hospital, right now, my brain is going, how did she get the nurse managers and leaders, or ancillary leaders as well, potentially, because you mentioned lab, not have the mindset going into this of, oh, great, this is just one more thing to do. I don't have time to read a book. I don't even have time to go to the bathroom. Like, how did you flip that mindset? Because I'm very curious, because I think, that is often an issue, right? Where they're like, I have so many other things to do. I have the budget, I have payroll, I have this. And, how to make them feel like, no, this is worth your time. This will help you in the end. I'm very curious.
It was a challenge, so I'm not going to say that it wasn't, but I think we did an intro to the program before we started so that they at least had some baseline information as to what is our initiative and what are we trying to achieve through this process. And I really tried to highlight, like, we really want to focus on you. Yes, it's leadership development as well. So we did put in some core leadership things that we wanted them to learn. But our main focus was, how do we get them to take better care of themselves? Because it is a trickle down effect. If my leaders are taking care of themselves, they're resting, they're taking the time that they need, they're really focusing on their own health and well being, it's going to trickle down to our staff. Which, if our staff are also happy and focusing on those things, it's going to trickle down to our patients. I know it's kind of a top down approach, but we feel like if we do this step, it's going to eventually get to where we need it to. But we also try to explain to them that this is time vested. This is time that we want to make sure that you put on your calendar, that you show up, and that you be open-minded about the process. And when we invited others, part of the team, it was more focused on nursing, but we flipped it around a little bit so that it would apply to anybody, regardless of what type of position you were in, regardless of whether you were nursing or non-nursing, because at the end of the day, it was about self and not necessarily about your role.
No, that makes the total
Yeah.
sense. And I'm not trying to interrupt you, Brandy, but I have another thought. So, because I saw this so many times for years, how did you get leaders to trust another coworker enough to be able to step away? Because as nurses, we like ultimate control, right? And we're like, oh no, nobody's going to do it as good as me, or they don't know how to do my unit. How did you get them to trust? No, whoever's covering you is going to do a good job. You need to take the time off. How did you work that in? I'm like very, very curious.
Well, most of the coverage structure that we have, it's usually somebody in a lights unit. So they kind of knew the workflows already. So it wasn't like we had to retrain people on the process or what needed to be done. Now, if it wasn't somebody that they worked with as often, we told them to set time aside to meet with them prior to you going out. These are the key things that I need you to help me with or to check on. So almost like a checklist, but not giving them work where they feel overwhelmed, like, oh, I agreed to cover this person and now I have 20 other things that I have to do on top of my regular work. So we did ask them to streamline it a little bit. And then the things that I knew that I had access to, like their payroll and their schedules and things like that, I agreed to manage that in addition to my assistant director so that we could make sure that those things still got done and they didn't have to worry about it. So it wasn't necessarily just getting one person to agree. We as a team all agreed on certain components that we would also take care of so they didn't have to worry about.
That's definitely, that's support. It's like what you need for sure, that leadership support. Yeah, like you said, like if my cup is full, then my nurse's cup is fuller, and then the patient in turn gets
as a
better
nurse,
care.
You don't always have people that'll agree to do certain things for you. It's almost like
Right.
I'm voluntold to do this versus these are the dates that I'm planning on taking off. Is anybody able to help? And when you see people volunteering to say, oh yeah, I can help you on those days. I don't have much on my schedule, or I don't have as much on my plate, or I don't have these new projects that I have to work on. It's fulfilling to me because it just shows that they really do think about everyone as a team versus I'm kind of in my own silo and I'm doing what I need to do to stay alive.
Wow. Do you have what are your specific, why do you think it's so bad in nurse leadership? I know we had talked about there's a lot of pressures and things like that. What do you think there's a one driver? What's driving this trend in nursing leadership?
I think it's just how a lot of us were brought up as leaders, that you work based off of how you were trained and how your previous leader managed certain things, and that you weren't always given that ability to do the things that you needed to do for your own personal self. And I'm not saying that it was right or wrong, but I do remember a lot of my previous leaders that never took off. You could tell that they were tired. You could tell that they had a lot on their plate. They delegated some things, but they tried to do everything themselves. But I think it's just our history on how things have gone. But now with this newer age, when
I was like, that's exactly what I was going to say.
our
Do you
newer
think it'll
generation
shift?
nurses, oh no, when they come and interview, they're like, okay, what days do we have off for holidays? How much
Wow.
PTO do I like? They're already asking those questions in advance because they are all about self. Whereas we're the opposite.
Yeah, yeah.
We're all about our department. And, I remember starting as a new grad in the ICU. And if you called out sick, you should have been, you were
Man,
dying.
I feel like you had to like come up with like I feel like I was laying upside down to make my face like as nasally as possible so I could call in so I didn't feel as bad because it's like, oh no, I
Because they
promise.
will
I
give you,
promise.
they will make you
I'm
feel
feel
terrible.
horrible. It's like we had a
Yes.
horrible shift because we were down a nurse.
But you made it through. And that's my
Yeah.
whole thing that I try to tell everybody. Your absence for 1 or 2 days or even for a week, yes, we're gonna miss you, but the work is still gonna get done. The place will still be here. It's not gonna burn down in that short period of time, and so don't check emails, don't answer calls unless you have to relay something. Really try to disconnect yourself from this place because it's gonna be here when you come back.
I think that is one of the hardest things because, I think especially middle management, the unit manager, I think that's one of the hardest jobs because you're on 24/7. You're responsible for staffing. If you had four call outs in the middle of the night, what are you going to do? Well, sometimes they have to come in. And so I think they're the group potentially that has the biggest issues with feeling like they can't step away. Now, I don't know if this is this way nationally, but I mean, I've seen it and I've heard it from people from various states across the country.
Yes.
So I'm tending to think it's more of a national problem. But I think it goes back to that feeling of not being able to walk away is the way organizations said, well, we're a 24/7 establishment and you must be here. And I don't care if you have to work 50 hours a week or 60 hours a week, right? The work has to get done. And so I think that makes it difficult for people to shift their mind. I think where this next generation has a better grasp is they know how to set boundaries that we were not taught how to set.
You
And I
better not
think,
say no. You just
right,
do.
right.
you
Yeah,
know,
that's
with the
what we were
fear that
taught.
my role might be in jeopardy because I'm not willing to do certain things,
Right.
or
And
I'm
now
not
it's,
available during certain hours, that I'm not responding after my leader had sent me an email 15 minutes ago, so
yeah.
it, it is a lot of pressure depending on what organization that you work for. And I've worked for many, and it was kind of the same expectation. And so here it's a little bit different. And I feel that there's more support from our leadership team to be able to do the things that you need to. Yes, we're still 24-hour accountability. Yes, we're still responsible for certain things, but there's not like this reprimand that comes behind it. If you say, my plate is really full right now and I can't take on another thing, they understand and they go to the next person to see if someone else can do it. Whereas before, you can't do that
Mm-hmm.
because then
And
it
nobody,
starts categorizing as you're not capable or you're not able to prioritize or you're not able to delegate appropriate. It comes with a whole nother list of things that get focused on versus this person currently has like 5 or 6 projects that you wanted implemented yesterday and she doesn't have the resources and she's trying to manage to, not
and
looking
now
at
she's
the
on
whole
vacation.
picture. Right. And then she took a
She's
day
on
off.
vacation.
What is wrong with her?
this makes me circle back to something you said earlier about the 6-month leadership program that you focused on. Did any of that include sort of shifting this mindset for people above the unit leader? Because obviously, if those individuals don't support that unit leader, it's going to be difficult to implement any change at all. And the reality is, if your nurse leader at the unit level gets ill and he or she has driven themselves to the ground, then what use are they going to be? Right. And now you might be off for 2 weeks because you're, super sick or something has gone wrong and the project's still not going to get done anyway. And I think not having the mindset shift of not one person can't do absolutely everything and there has to be things that are spaced out versus everything being an emergency all at once, I think is so crucial. So I'm curious as to, you know, how that was maybe incorporated and aiming for organizational support in these classes.
Well, our leaders definitely support. They supported the initiative that we were trying to do and what we were trying to accomplish. Of course, we had to do a whole proposal of what we were doing and what are the
You had to
expected
do more work
outcomes.
to
And
get not to do work.
but I do think that they realized that if we don't do a better job of taking care of our leaders, it's going to be detrimental for us because one, we don't have a lot of people jumping jobs anymore like we used to, or we have people that are jumping jobs when we're not able to meet their individual needs. And so we're constantly refilling positions and paying all of this money to orient and onboard, and then they may only give you a year. We did feel that that investment was very important for our leaders because we did see that if we don't support them, then who else is going to support them? If we didn't feel that this was the best initiative for our money spent, then what else are we spending on that's going to give us more bang for our buck? And then, I think the feedback from, because we surveyed our staff prior to our leaders prior to starting, and then after, like, what was some of their perspectives? What were they expecting from it? And then we did it afterward. And I was blown away from a lot of the comments from the leaders, just as we really didn't recognize that we weren't taking as well. We weren't taking care of ourselves as well as we thought we were until it was truly highlighted and we started talking about it and talking through some of our challenges. And, it's still, even though they've completed that portion of the program, it hasn't stopped. Our work hasn't stopped. We still are looking at other ways to really continue to focus on. We have a well-being index that they submit responses to every month as far as how they're doing, what support do they may need. And we look at those comments to continue to shift because we know from day to day things change. I might have been good today, but I might not be good tomorrow. And so being able to recognize that, we also did some work around how do we recognize when somebody is drowning? How do we recognize when someone is in a different mental space that they weren't in prior? And how do we support them through that process? Every organization has EAP services where you can refer them, but out of that, how many actually use the service?
Right.
And so we're trying to put other mechanisms in place as far as on-site support and who can they go through, who can they talk to, even if it's just a 5-minute chat to kind of talk through some of those challenges. And our next step is really to have like a wellness room with aromatherapy and a massage, just some other things to take them out of their own space to go to kind of refresh, renew when they're having that tough day. Because we all have tough days. Some days are better than others.
You mentioned about the Wellbeing Index app. Can you go, what is that?
So one of our psychologists is part of we now have a wellness team. But
fantastic, for sure.
Which has members from everywhere. We have our residents, we have some of our leadership team with that, we have some of our regular staff that's in that. But he found this app that when you initially do it, there's a series of questions. But once you get through those series of questions, it kind of gives you like where your mindset is at that given time when you've answered those questions. It will then send you reminders. Now you can do it as many times, you can do it every day if you want to score through to answer a few questions. But the idea is every month you go in and you take a look at the questions, you answer the question, and it gives you feedback. Like, do you need to focus on your sleep? Do you need to focus on your diet? It depends on how you answer the questions, but it gives you feedback based off of how you respond. But then it also gives him an alert, like if somebody is kind of in crisis, what we need to do to try to support that person. Reaching out to them to say, is your workload too heavy? Is there anything that I can do for you to support you? It's still anonymous and they don't have to put their name, but we ask them to because how else are we going to be able to help them when they are drowning? I mean, most times we kind of have a sense based off of their mood when you're rounding. You can usually pick up on body language, but some are not always open to, nobody wants to say I'm struggling today or I got a lot on my plate and I need help. We have a hard time saying that. And with that app, it is very directive as far as the type of questions that it's asking to try to gauge where they are as far as mentally.
I think that's really good because I like the more real-time aspect of it. You mentioned EAP, and that's really a different function, right? So
Yeah.
yes, you may need that for maybe dealing with some other issues, but to help have somebody take the load off of you or help you with your everyday work, having this real time, where somebody can see your score and reach out to you, because how many times people are afraid to say anything. They don't want to look like a complaint or whatever, and they just basically try to just internalize it and deal with it. And I feel like this is a good way to maybe help that not happen.
Mhm. I mean, that's our goal. And we hope that the real goal is just that people feel comfortable to speak up and not suffer in silence, because we're all here. We can all do pretty much everybody's job. Nursing is very unique where we have worn multiple hats. We're the pharmacists, we're IT, we're bioengineer because our equipment is now failed. We're housekeeping. We wear a lot of different hats, and there's a lot of things that we can assist, even if they're small things, to try to help carry the load some.
Mhm.
I know previously you had mentioned maybe that your health was also not doing so hot. Is this kind of like what kicked it off? Like, how do you sounds like you preach what you practice. Practice what you
Well, I try
the other
to.
way.
Here, my role is very unique because I do a lot of community outreach and engagement. And so I think the eye opener for me, probably the first or second month that I was here, I was going out and I was doing blood pressure screenings in one of our rural areas, because we're in West Alabama, but some of our rural areas are several hours away. So we'll go out, we'll do health screenings, we'll do education. And so I was doing a patient's or a community member blood pressure, and it was slightly elevated. So as I'm going through the range, because we use the American Heart Association guidelines as far as, if it's too high or if it's right in the sweet spot. And I'm going through, like, you might need to change some things in your diet. Here they eat a lot of pork, a lot of beef, barbecue is the big thing here. I came from DC. That wasn't necessarily the same thing. We were big
The
on
good
seafood.
stuff, the good stuff,
Yes.
the South. That's where all the good stuff is.
And so, I'm going through and I'm teaching her on that. And I'm thinking to myself, well, I'm telling her all of this, but I'm not doing all this myself.
Like, hold up, hold up.
So, like, it's hard for me to teach somebody on this when I know, we, as a nurse, we've all taken nutrition. We know what we're supposed to eat and not supposed to eat. And so I said, I need to make a shift. I need to make changes to my own diet. I need to increase my activity level. I need to drink more water. All the things that I'm telling the patients to do, I need to be doing it myself and trying to encourage others that are around me to do the same. So I stopped eating meat. I'm pescatarian now. I work out 5, 6 days out of the week. I have a little senior team that meets me every 5 a.m. every day.
Woo!
And they will hold you accountable if you don't show up. But just making slight changes. I'm not saying that everybody has to be that dramatic, but I felt like if I continued the route that I was going, I was just going to revert back to the same process. So it is definitely a lifestyle change. But I'm so happy that I did do it. On good days like today, where it's sunny and it's warm outside, I have the ability to take a walk around our building. And I encourage other people to come with me. If they're sitting outside or I see that they're about to take lunch, hey, come take a 15-minute walk with me. Let's chat. If I don't mirror it myself, then it's hard for me to preach that these are the things that you're supposed to be doing. And so that was why I made such a drastic shift. Now, am I where I need to be? Not yet, but I'm going to eventually get there. I know that I didn't get this way overnight, and it's a process. And so I just have to stay consistent.
I was like, now after your leadership, your initiative and things like that, have you seen a difference in your leaders?
Oh, absolutely. Absolutely. Even leaders that I don't manage myself, like they even come and they'll come and chat about, these are the things that's going on right now. They'll ask for feedback. And, even though they're not on my direct team, I'm open to anybody that wants to come in and chat about anything, because we're all a work in progress. We're not going to make drastic changes overnight, but if everybody has the same mindset and everybody's trying to make the same shift, it's important to continue to support that and to continue to have those conversations and not close anybody out.
That's great. And I think too, I think we forget, even though we know it, I think we forget how much supporting our physical health helps our emotional health. And then you
Absolutely.
are able to feel more, I don't want to say stable, but for lack of a better word, but when you feel more stable, I feel like you can be more productive too. It's everything doesn't feel like it's falling out, down upon you. So I think that's, really great messaging. And I love that your leaders are doing it with you and that they are seeing the benefits of it, which I think is great. And I know there's one other thing I wanted to touch on because we haven't talked about it, and that was something that had been mentioned about, clinicians not being at 100%, right? When you're not at 100%, whether you're the leader or you're the bedside staff nurse, it really doesn't matter, but your attention to detail can drop off and errors can occur, which is why this mental improvement from physical activity can really help. But from an institutional standpoint, why is enforcing, rest, shift limits, et cetera, a matter of patient safety really versus just the employee preference, if that makes sense?
Yeah, no, it definitely makes sense. I think some organizations have stipulations on how many shifts a nurse can work in a week, or at least consecutive. Some organizations don't. If they have a need and somebody wants to work it, they let them work it. But we know realistically, there's been a lot of studies that have been out there around safety that after your third 12-hour or your fourth 12-hour shift, your thinking process is not as clear. There's a high incidence of errors that occur, whether they're small or whether they're detrimental to the patient. Even for leaders with managing their time and managing certain projects, their attention to detail continues to decrease when they don't have that time set aside for proper rest. And for me, working in an organization, me as a leader, whether I was in a management role, director role, senior director, and then now here, I do put stipulations around how many shifts a person can work in a work week. Because I do feel I try to put myself in that patient's shoes. Would I want that nurse that just worked 2 shifts, or would I want that nurse that just worked 5 or 6 shifts in a row? Safety is first. And I want to make sure that people show up and they're at their best and that they are cognizant of everything that's going around and that they understand that impact when you work so much. And I know financially some people are struggling with all the changes and, with increased rates on everything. But you also have to take in consideration, what is that trickle down effect if I miss that small detail? Is that going to be impactful to our patient? Is that going to be something that may jeopardize my license that I worked so hard for? Just because I wanted to work a couple extra hours. So we try to think about long-term effect. One, it could affect the patient, but it also can affect you because of it's a liability. And I know that they don't want to put a hard rule on that, but we have to think realistically that somebody that works that much, they're not getting that much sleep in between, and they're coming back and they're doing the same process. And then we get sometimes complacent because we're expecting the same thing every day. We know patients change, their conditions change pretty rapidly sometimes. And are we catching those signs early on to be able to catch and intervene? And so that has always been my biggest concern. And, when I manage schedules directly, people sign up. Okay, thank you. I appreciate you signing up, but you haven't had enough
No.
days off in between before I can put you on another shift. And it's a hard pill to swallow sometimes when you know you have a need, but you also have to think about, who is that going to impact? Is it going to impact their team, the patient, themselves? So I have a hard stance on that, but not everybody is the same.
What about the nurse leaders who feel overwhelmed, maybe burnt out, maybe they're just tired? What is like something you could say, like, all right, practical step, like take it this week so we can start moving forward towards a healthier, because like everything you're saying is just makes so much sense. So it's like for those that are kind of identified that like, yes, I'm overwhelmed, I'm headed to burnout, like what is something like a practical step?
A practical step For a nurse leader, I would say start small and work your way up. So if you have a hard time being able to take time off, start small. Say, I'm going to come in 2 hours later, or I'm going to take 4 hours versus
Well,
my
that's
8 hours
great.
off.
Yeah.
Start making goals for yourself or making lists for yourself of the things that you know that you would like to achieve, but you haven't been able to because you have felt so much of a burden to not trying to keep up with everything else. Start thinking about your workload and what things can be delegated to somebody else that you don't have to physically do, but still have oversight on. Because I think sometimes as leaders, we don't always look at others on our team that are more than capable of managing certain things and are hungry for those things, but we don't give them that opportunity. And so looking at your team as a whole to see who are we all know who our strong folks are on our team.
We all know.
When can we get to them, but not overstep, or we tend to always use those stronger team members, and sometimes we give them too much because we always know that they're going to agree to do it. But
It
trying
perpetuates
to,
a cycle, It's like, you know.
but in my role, I have always, yes, I use my strong individuals, but I also look at who on my team I feel that I can really focus and invest some time on to level up, to get them to the
Yeah.
next level,
Let's
to
tap
get
on
them
the shoulder. Like,
to get them to agree to certain things and to, continue to follow up with them. How are they going? And giving me an update and giving them some deadlines around that to build them up to the point where you can utilize them. Because we do oftentimes will burn out those high performers, and then they just decide I'm not going to help anymore. Like, I'm not getting paid for this. You're not giving me anything extra to take on this extra work. So you want to be able to somewhat incentivize them, but you also want to give others the opportunity to do things. And some staff don't always speak up to say that they want those opportunities, so you kind of have to seek them out.
yeah, definitely. I know one thing I did, not that we're talking about me, is I blocked my calendar for lunch, which has been successful, somewhat, sometimes. It doesn't work 100%, but at least there's like a block in there that I'm like, I should probably eat around this time. But it was something that I had to start small, and it was like, okay, this is at least like I have to eat.
Yeah. Yeah.
And it wasn't. So yeah, so I think that practical tip, just starting small. You didn't get this way overnight and think it's a good, you're not going to fix it right now, but
And I've done that too. I'll block off time when I know there's something that I really need to work on to be able to focus and designate that time. Because if you let others manage your schedule, you will literally be somewhere or doing something your entire day with no breaks in between. I mean, I literally had one day where I was in meetings from 8 a.m. until 5 p.m. and there was not even enough time to go to the bathroom. So, you have to be cognizant of that and you be in control of your schedule. If you know that that's not going to be feasible, or if you need to move things around or move it to later in the week, speak up and say it. Because your time isn't everybody else's time sometimes, and you have to be aware of that and be able to speak up and advocate for yourself.
wow, I've learned so much today.
I know.
It's just like you just have to remind, like, you have more influence over things than you think you do. So it's like your behavior really does impact other people. So it's like, your cup's not full where you think you're doing okay, but then it's like the next person it affects, and then it really does trickle down, to those patients, because it's like you're not, I don't know. When I'm tired, I'm definitely not at my best self, and it just kind of all trickles
None of us
down.
are.
Yeah. I just think it's so great that like a leadership team is like, this is important, like highlighting the importance of it. And it's like, because I feel like often we don't talk about leaders and burnout. It's focused on the bedside, which is equal, is important, right? Like, but that making sure that leadership, is also being cared for is, I think, fantastic.
Are there any mindsets or principles that either help you personally stay grounded to continue to lead with purpose, or that you could share with other leaders for them to be able to do so?
I don't know. For me, I think of every person that we serve as how would I want my family to be cared for. And so if we don't have that kind of in the forefront of this is the impact we could make, I'm not sure where we would go without that piece. And so, I take my leadership role seriously because they didn't have to put me in it. But I also try to mimic the behaviors that I want to see across all of my teams. And, I'm just because I have a title, that doesn't define who I am. And, when I walk through, if there's trash on the floor, I pick it up. If I see that somebody needs assistance, I walk them to that direction. If somebody has a question, I always stop and be cognizant of, you see somebody is looking and they don't quite know where they're supposed to go. Why don't you just ask versus walking past them because you're trying to get to the next destination? And so I try to role model those same behaviors as on a daily basis because I want everyone else on my team to do the same. It's hard to get people to abide by what you're asking them to do if you don't do it yourself.
We appreciate all of the information that you shared with us today, and we really appreciate you joining us. You've got depth of knowledge and expertise on this topic, and I think you've done some great work at your organization regarding burnout and well-being.
University of Alabama, they should be glad to have you.
I hope so. I'm so happy to be here.
That is wonderful.
Thank you for joining us.
You and your questions.
Well, our goal is to help others and share knowledge. And so I would like to leave our listeners with one takeaway from today's episode. So if you could ask healthcare organizations to do one thing differently so that leaders, nurses can reach retirement age healthy and whole, what would it be?
To have more flexibility in their schedules, to designate that time off.
Just to be able to take a day off and not
worry. Not that it should feel forced, but automatically say every 3 weeks, this is your designated day to be off, or you need to submit your time by this day so we can ensure that we give you it off. You don't carry that guilt about requesting a day off.
And ultimately, hopefully you'll be mentally and more physically sound and healthy, which should hopefully lead to longevity.
Because I want to make it to retirement, and I want my teams to make it to retirement. I'll never forget the first one of the nurses that I worked with, hardest working nurse that I had worked with in the ICU. She did everything. She worked extra shifts. She made it to retirement. And a week later, she had a heart attack and passed away.
No.
Yes.
Oh, no.
Oh,
and that's why she talked about it, is I can't wait till I get to retirement. They had a whole celebration for retirement. And then the following week, she had a heart attack and she passed away. So she never got to really enjoy her retirement because she burnt herself out over those years with the amount of work that she did. And that sticks with me daily, that you work that hard, you give so much of yourself, and then the end result. I'm not saying that it would happen to everybody, but I just think about, if she took better care of herself, or if she didn't work so many shifts, or if she didn't give so much to everybody else, would she still be here?
No, but there's truth to everything you said, because all of those things do come into play. Lack of sleep, lack of proper nutrition, too much stress. We know how stressful ICU shifts can be, and they're long, right? And then if you pick up extra shifts and you're having an empty cup, you're not caring for yourself, you're caring for everybody else. And unfortunately, that is a risk. So I appreciate you trying to save others from that same fate. And again, we can't thank you enough for being here with us today. So in closing, I would just like to thank our listeners for continuing to join us on our podcasts. And please feel free to email podcasts@aacn.org with any feedback on this episode or ideas for future episodes.
Thank you for listening to the American Association of Critical Care Nurses Voices in Nursing podcast, proudly sponsored by AACN's award-winning online leadership course, Fundamental Skills for Nurse Managers, with information available at www.aacn.org www.robbinyoung.com/manager skills.